Thank you. 7:09 is the time. One of the most striking and upsetting images so far to come from the coronavirus outbreak in China is a set of pictures of the doctors and nurses who have died, people in good health and the prime of life. At least 29 of them, possibly many more. So how here can we protect people dealing with those who may become ill? And, of course, by protecting them, reduce the impact that the virus has on all of us. Niall Dickson is here, Chief Executive of the NHS Confederation, which is the association of organisations that provide the range of services in the NHS, and Sarah Gorton as well, who is Unison, the trade union's head of health. Morning to you both.
Morning.
Sarah Gorton, first of all, your members, well, I mean, quite legitimately must be worried.
Yeah, I mean, it's really important that we don't panic, but we also know that planning now can make the world of difference later on. Healthcare staff play a really important role in reassuring the public and giving advice. Trade unions are working with employers and trusts to make sure that staff know what to do, and we're issuing guidance from the NHS Staff Council. But it's really important that if we're going to rely on health teams to look after us, someone's also looking out for them as well.
And it is a fact, isn't it, Niall? One of the really striking things in China is that among those who were obviously very badly affected quite early on were those who were treating people. Have we learnt, do you think, from China's experience in a way that will be useful to the rest of the world?
I think people will be looking very closely at what happened in the early stages of the outbreak within China. But of course it is a very different healthcare system. I think I never want to be complacent about this, but we have a very effective public health system here, and secondly we have a National Health Service that is very geared up to dealing with infectious diseases. So every year people are dealing with norovirus and flu. That's not to say that we shouldn't be worried. I think people will be more worried now that they're seeing this virus hit more familiar health systems, such as in Italy, for example, well-developed systems such as Spain and so forth. So I don't think for one moment one should be complacent about this. But preparation, as Sarah says, is the key thing. We've been preparing for weeks for this now. The good thing, I suppose, well, two good things. One is there is time, so we have been preparing at all kind of levels, at all sorts of scenarios being dealt with on the one hand. And secondly, of course, the indications are that this virus, for the vast majority of people, is pretty mild, so that self-treatment, dealing with it at home, will manage for most.
But that's so striking that so many doctors seem to have succumbed in China.
Yes, it is. And of course, very close proximity. And again, if at the early stages they weren't quite aware what was happening, that may be, I'm speculating, but that may be the reason why those individuals were affected at that time. So we do need to protect our staff.
What are the staff being told then, Sarah Gorton, about? I mean, part of the obvious stuff about the kind of practical measures that people anyway take in hospital. What extra things can be done?
So there's three broad areas that advice should cover. So firstly, it's around communications and making sure that everyone, from cleaners to consultants, from healthcare assistants to occupational therapists, know what the plan is in their place of work. They're clear about the advice that they're giving to patients and about how they can minimise the risk to themselves as well. Secondly is around the advice that, about the staff who are moved to the teams that are set up to test or treat patients. So far, affected people have been treated in specialist centres, so that might change as this goes on, and we need to adapt to that and make sure that staff can look after patients at minimal risk to themselves. And then thirdly, there's the impact on the teams that those staff are taken from. So thinking sensibly about planning for those situations.
It is a lot of it about flexibility, actually, isn't it, really, Niall Dickson, and the way that we use hospitals and other facilities as well.
Yes, it's about flexing as the situation changes. So at this stage, it has been about identifying cases, isolating, containing, and then investigating, which is a standard public health approach to these things. And thus far, of course, within this country, that's been successful. But of course, as the number of cases increase, and it's pretty likely that it is going to increase, of course, that system will be tested more. Secondly, it's about protecting those institutions like GP surgeries and hospitals, making sure that if people feel that they might have got the virus or they're showing any symptoms of that, then they should dial 111, not go along. And even if they do turn up hospitals, there'll be a pod for them to go to, separate diagnostic areas. So it's just about trying to minimise that risk, as undoubtedly we will be faced with more cases.
Yeah, and coping outside hospitals and GP surgeries and presumably in care homes and in places where this work can be done.
And again, that I think is doing stuff we already do, but at a larger scale. So engaging with organisations like Age UK and the Red Cross, mobilising people who can identify the vulnerable who may be at risk. And of course, individuals can do this as well. If there's any question of self-isolation, one of the things about self-isolation is certainly keep yourself away from very young children and from older people. So it's a combined thing. It's not just about what the health service does, and the health service will do everything it possibly can. It's also about individual behaviour.
And individuals not panicking too, Sarah Gordon, and even if it does become something that is very widespread, it is going to have to be, it's not just health workers who are dealing with this as it is all of us.
Indeed, and I think there are two particular areas to focus on. So one of them is to think about those staff who are employed and in and about our hospitals and healthcare centres who aren't directly employed, and think about them, making sure that they're included and involved. And in particular, those who work in the social care sector, lots of contact with vulnerable and frail people, and we need to make sure that those employers do like the NHS employers do and step up and act responsibly as well, and make sure that they don't that they remove any incentives for people to come to work if they're not feeling well themselves.
Sarah Gordon and Niall Dickson as well. Thanks both very much.